7 years clear this June, no recurrence, no side effects whatsoever. So I've got the life I had before prostate cancer, and that's thanks to focal ultrasound. It's a complete life saver, lifestyle saver, and life changer.
Welcome to Curing with Sound, a podcast presented by the Focus Ultrasound Foundation. I'm your host, Allison Preston Smith. Prostate cancer is the second most common cancer in men globally and the fourth most common cancer worldwide. Paul Sayer of the United Kingdom experienced his own diagnosis with the disease in 2018. His cancer was aggressive, and doctors wanted him to undergo surgery within 10 days, but Paul decided to do his own research and requested focus ultrasound treatment for its non-invasive nature. Paul is now cancer-free, and his experience inspired him to create the charity Prostate UK just months after his initial diagnosis. Now, Prostate UK is increasing awareness on focus ultrasound treatment for prostate cancer and funding and delivering focus ultrasound units in hospitals. Welcome to the podcast, Paul.
Thank you very much for having me here.
When did you learn you had prostate cancer?
I guess back in 2016 was the first suspicion when I had a prostate examination, was told it was slightly hard and they'd keep an eye on things, but like the health service does, it didn't. So in 2018, I went back to the GP for an unrelated issue. The GP said, let's have another look, and discovered that things had moved on a little. And that from that point, I was pushed into the system. And
did they give you any recommendations for treatment? Did they want to look at surgery or medication or anything else?
The GP didn't. The GP pushed me straight through to the hospital. So that was the usual route of MRI scan, followed by a biopsy, and then a meeting with the two consultants that were my choices at that point, basically radiotherapy or surgery.
And what were you thinking about both of those options? Were you a little leery on them or looking for other options?
Fortunately, I sort of guessed that would be the options that would be presented to me. So I did a bit of research ahead of that, discovered a few options, one of which was focal ultrasound. And I presented those at the meeting to both consultants. Both consultants spent more time telling me how bad the other one's modality was, and both, oddly enough, dismissed focal ultrasound as flaky, only on trial, and not suited to my cancer.
Oh, no. And so at that point, was focus ultrasound off the table for you, or?
No, it just made me more determined, basically. So I carried on the research that I'd done before that point. I managed to find a consultant at Imperial College in London who was doing focus ultrasound on a trial, who then directed me to Professor Hashim Ahmed, who was doing it for the NHS. So I managed to get a referral into him, had a meeting, a totally different story altogether, pulled my records up, said, absolute perfect candidate. Let's get you in and get this done. 5 weeks after that day, it was done.
That's amazing. Did you have to do anything to prepare for the treatment?
No, it was a very, very straightforward process. Just that sort of 5-week wait and then the preparation on the day that goes with a procedure of that kind. So no, it was a very simple build-up.
When you think about the side effects with surgery versus focus ultrasound, what were some of the side effects that you could have after each treatment? Right,
on the surgery and the and the radiotherapy, both were going to carry a very high chance of incontinence. The surgery would have been probably lifetime incontinence. The radiotherapy would have been for a long period of time and with some residual afterwards. Erectile dysfunction is obviously another major issue with those. Both of them had quite high statistics. Also, with the radiotherapy, you've got the risk of bowel damage and such like as well. So there's other issues. But looking at the statistics for ultrasound, they're both below 5%. On both those areas.
Did you have any side effects after treatment, or was recovery after treatment difficult?
No, it's quite strange actually, because the only issues I had were I was feeling a bit sick after the anaesthetic, which is pretty normal, and the catheter for a week wasn't the most comfortable of things to have. But with the charity side of things now, we've helped several hundred men through, and they all complain about the anaesthetic or the catheter. No one complains about the procedure, which proves how minimally invasive it is. Yeah.
That's so wonderful to hear. So after your own experience, you decided to start your own charity, Prostate UK. What made you so passionate about this topic?
Absolutely. I mean, when I came out from hospital, the next day I was at my table at home with my laptop working as if nothing had happened. I just couldn't believe how good it was. So obviously I just became an advocate for it, just started broadcasting how good the thing was. But having got to the professor in London in quite a circuitous route, we got talking and became quite friendly, actually, over the period of time I was under his care. So he told me about the 12,000 men a year, at least in the UK, who could be having focal treatment and weren't. And that kind of stuck. So I went away, had a little think, gave it 2 or 3 weeks, made another appointment, and he actually saw me to just go up and talk through some ideas and put forward the idea of building a charity that would create awareness to get more men to know that they can have this treatment, and also to try to get the facility expanded across the UK, because it's just in London at that point. There was nowhere else to go.
Tell us about the experience getting the charity launched and running.
Okay, that's quite interesting, actually, because when we first set it up, so myself, Professor Ahmed, and an MP, David Amis, we set the thing up between the three of us. And the initial idea was to come out with a campaign called Know Your Choices. And we were going to go far and wide. We got some good press coverage. We had a launch in Parliament for it. And the idea was to get as many men as possible to know about the benefits of ultrasound treatment for prostate cancer. So we put together this campaign. The whole thing was due to launch in April 2020. And you might remember what happened just before April 2020 here in the UK. COVID kicked in. So we actually hit a brick wall. But in some respects, that was a good thing, because what we hadn't taken into account, there were only 2 centres in the UK, both in London, really offering focal treatment. So if we'd got this massive nationwide uptake for it or interest in it, we would have created a monster, because there just wasn't the facility there to cope with it. So during COVID, we switched, not by choice, but because the NHS system basically cut off anything to do with medical treatment other than COVID. We had men who were newly diagnosed, partway through diagnosis, facing treatment, with nowhere to go. The NHS had cut them off. So they were coming to us. And Professor Ahmed and his team at Imperial College, bless them, they were taking these patients. So we were actually a triaging service, putting patients through that system. And that stuck afterwards. So we've kind of got this burden that we carry now, where we're having to triage and get patients through the system. It's a great one to have, but it does tie us down. But we've re-put the system into place, and now we're looking at deploying focal therapy units into NHS hospitals around the country. So we've got that facility to uptake on the demand.
What has it been like trying to get more focus ultrasound machines into hospitals across the UK?
The biggest issue has been funding. So we've been raising funds to assist with either buying the units or funding at least the first year, so that hospitals can prove that case study and show that the thing works. And we put a unit into Bath, RUH, in December 2023. We funded the first year of that with the Focal Ultrasound Foundation. It was a great project we got together on. So we paid for that first year's running costs for it. And just last month, they bought the equipment outright. So that unit is now secure and running and safe to go. We're looking now at similar ventures with other charities to put units into other hospitals where we'll fund this initial costing. It'd be quite nice to work with the Focal Ultrasound Foundation on those too.
What do you hear from the patient population that you work with?
Oh, most of them are so delighted that they can actually be accepted into the system. But the funny thing is, with patients who've been through the system, we don't hear from them in most cases. And I class that as a success, because the only people who will come back and tell you are those who've got a problem or suffering. So the people who go through focus ultrasound get on with their lives, and I'm happy with that. That's a success.
And what's next for Prostate? What are your goals for the next 5 to 10 years?
Okay, this current year is one of the most exciting so far. We've got probably 5 hospitals that we can actually deploy focal units into this year, including one in Scotland and one in Wales. And that's essential because although the NHS is so-called national, we can't get men across the border for treatments in the UK, in England, sorry. So this year will be a very exciting year. We're trying to get those 5 new units in across the UK. And then beyond that, it's just awareness, just feeding men in, letting men know it exists.
How can our audience keep up with you?
The best way to find out more about the charity is the website, which is www.prostate, so that's PROST and the number 8.org.uk.
What would you tell to others about Focus Ultrasound, or what would you say about it?
The fact that everybody that goes through it comes out the other end and can't believe they've actually had a procedure. They cannot believe that they've actually gone through the hospital, had cancer treatment, and walked away with their lives intact. So for that reason alone, just do it. If you're eligible and you meet the criteria, it's a no-brainer. 7 years clear this June, no recurrence, no side effects whatsoever. So I've got the life I had before prostate cancer, and that's thanks to focal ultrasound. It's a complete life saver, lifestyle saver, and life changer.
This episode of Curing with Sound has been presented by the Focus Ultrasound Foundation. If you'd like to learn more about Focus Ultrasound or the Foundation, visit our website at fussfoundation.org. You can also sign up for our newsletter and follow us on social media. Be sure to subscribe to the Curing with Sound podcast so you don't miss the latest information about Focus Ultrasound. You can also rate and review the show.